What is the cost of a life? Is a life worth a picnic in a park? Is a life worth going to the beach? Is a life worth having a few cold ones with your buddies in the basement? The answer is no. None of those things is worth as much as a life. So to everyone in Ontario, we need to listen. We need to listen to what the data tells us. We need to take action. We must take these warnings seriously.
Ontario Premier Doug Ford warned the numbers would be stark and sobering, and they were. Hi there and welcome to Power in Politics. I'm Vashi Kapelos. Ontario health officials released their projections today for COVID-19 and the devastation it could wreak on the province. They expect the virus to kill as many as 15,000 people in Ontario over the course of this pandemic, which could last up to 2 years. But it could be much worse without social distancing measures or other measures taken. The death toll could have reached, they say, 100,000. Here's a more short-term outlook. Had Ontario done nothing, 6,000 people, the data shows, would be dead by the end of this month. But with current restrictions, Ontario can expect approximately 1,600 deaths. That could be reduced further to 200 deaths if stronger measures are implemented, and some of those stronger measures were announced today. Another troubling statistic, Ontario's ICUs are running out of beds. 900 will have to be added to cope with the rising number of serious cases. Dr. Callie Barrett is a critical care doctor at Toronto Western Hospital and is a part of the COVID-19 Modeling Collaboration, a group that's creating healthcare resource use models to identify capacity constraints. She's in Toronto. Hi, Dr. Barrett. Thanks very much for making time for us.
Hi, thanks, no problem.
Doctor, so Ontarians, I think, and Canadians, we're all watching today, and there's a lot of numbers that they got, a lot of projections they got. If you were to identify, from your perspective, the headline they should take away, what is it?
I think the most important thing that Canadians need to take away from today's briefing was that we are facing a significant public health crisis across the country, and that it is only with the efforts of healthcare workers in hospitals and healthcare systems to increase capacity, which we're doing our best at, as well as the public adhering to physical distancing. It's only with those two efforts combined will we be able to prevent overwhelming our healthcare system.
I want to ask about capacity of the healthcare system in a second, but when it comes to the data itself and sort of the models put forth, can you help us understand? There's so much debate lately about, are they helpful, are they not, how accurate can they be? What would you tell people watching now about the accuracy of the numbers that they just heard?
So, a model is as good as the data that it's informed by. And certainly our group's efforts have been informed by Ontarian and Canadian data. And we modeled 3 different scenarios based on observed trajectories that have occurred. So we modeled based on the observed trajectory in South Korea, in Italy, and then observed what's happened so far in Ontario and modeled a prediction based on that. So in our model, we had a worst case, a best case, and what we think is going to happen in Ontario. And so what Canadians can take away is these models give us a picture of what could happen if we did a better job at flattening the curve, if we didn't adhere to flattening the curve and we got into trouble like they have in Italy and Spain, and they're getting into in the United States, but also what can happen if we sort of don't do anything more.
And I guess that's the question I had when I watched, or when I was listening to the presentation and watching it, because the numbers are something that we all want to grab onto, right? But obviously our behavior can impact what they eventually end up on. And I guess, I'm wondering for our audience, if we do adhere to everything, is there a scenario at which, it's not over 1,000 deaths next month or this month?
So, our model didn't look at the number of deaths. That was another team's model. I think what's important for Ontarians and Canadians to remember is that we shouldn't be focusing on the exact number that a model puts out, but the overall trend. And what certainly our results have shown is that flattening the curve and adhering to physical distancing will absolutely reduce the number of patients presenting to hospitals with COVID-19. But also, by increasing the capacity in the system, we can reduce the burden. And so what our model showed was that only when we both flatten the curve through the public adhering to physical distancing and we increase the capacity through finding additional hospital and ICU beds, will we be able to prevent getting into a situation where we don't have enough resources for the patients who need them.
Let's flip to the capacity side of this, and that the last point that you made around especially intensive care beds. Where does the situation sit right now?
So according to today's report from Critical Care Services Ontario, there are 415 beds that are currently available for COVID-19 patients, and there is about 55% of the capacity of ventilators available for patients. So right now we're doing okay. We have capacity. But what we're worried about is the rapid increase in the number of patients who are going to need an ICU bed or a ventilator over the next week or two. And we do have the ability to surge up by spilling over into other units that we wouldn't normally put our critical care patients in, or ventilating patients in the recovery rooms for the operating theaters, or actually ventilating patients in the operating rooms themselves. And so by spilling out into those other areas, we can create additional capacity, absolutely. But we may still get into a situation where that surge capacity is not enough if we don't flatten the curve.
Is that work underway for surge capacity already?
Yes. Hospitals have been diligently working at identifying additional surge capacity for a very long time. And across the province, and I'm sure across the country, we have been working on trying to identify extra space for these patients, yes.
Alongside data, there has been a big discussion as well this week around the availability or lack thereof of supplies. Especially today, the focus is on those N95 masks, thanks to sort of the political discussion back and forth where 3M is concerned. From a supply perspective, what is your experience so far? And are you worried about sort of PPE being available?
So I can't speak to the supply because I'm not working on that. But I certainly know that at my institution right now, we have enough personal protective equipment. But we also know that if we have an overwhelming number of patients, we could run out of N95 masks or face shields or gloves or gowns. And this is a global pandemic. And so every single institution in the world right now is scrambling to identify more PPE. So I think the global demand probably outstrips the ability of these manufacturers to produce this equipment. And I think it's important for the public to recognize that if they don't do their part by adhering to physical distancing and flattening the curve, they may contribute to healthcare workers being in a position where they don't have the PPE to look after them. Because the number of PPE or masks, whatever that we go through, is proportional to the number of patients we're taking care of.
Before I let you go, one more question on the sort of overall modeling, and that is around, I think, another number I'm guessing stuck out to a lot of people when we heard that the pandemic could last anywhere from 18 to 24 months. I think the first question most of us had is, okay, is that how long we're going to be observing these kinds of measures, physically distancing, not going to work, businesses closed down? I ask with the caveat that obviously our behavior right now can completely change what happens a month from now or 2 months from now. And I know that there's no such thing as a crystal ball. But loosely, how do you interpret that? Is there the possibility that this kind of behavior has to be observed for that long? So,
yes, my understanding from my conversations with the epidemiologists is that this is going to be it's not going to be something that we're going to be able to fix with 2 or 3 weeks of physical distancing, that this is going to take some time and that we're going to have to flatten our curve over a long period of time in order to prevent that surge and overwhelming of the healthcare system. And so I think this is going to be something that we're all going to have to really adhere to for quite some time.
Okay, I'll leave it there. Thank you so much, Dr. Barrett. Appreciate your time this evening.
No problem. My pleasure.
Cities, of course, in Ontario have been on the front lines of this crisis when it comes to trying to stop the spread of COVID-19 through fines for ignoring physical distancing measures, for example, by closing parks or other public spaces. So What do mayors think of the projections coming out of Ontario today, the modelling released by the province, and how could it impact their response to the pandemic? Drew Dilkins is the mayor of Windsor, Bonnie Crombie is the mayor of Mississauga, and Jim Watson is the mayor of Ottawa. All three of them join us from their respective cities. Hi there, good to see you all. Thanks for making time for us.
Thank you.
Hello, Vashi.
Thanks, Vashi.
I'm going to start off with a very simple question to all three of you, and I'll start with you, Mayor Watson. What was your takeaway as you heard the modeling, the numbers, the projections from Ontario health officials today?
Well, it was quite frightening to see those numbers, and I think it gives us evidence once again why at the municipal level we're doing our very best to encourage people to respect the physical distance concept, to stay out of parks, to not gather in groups of more than 5 people, because not only are people, when they're doing that, being irresponsible, it's illegal. And we see the impact that if we don't start modifying the behavior of that small minority, the situation could be very, very dire indeed. Mayor
Crombie, what was your takeaway?
I thought the numbers were very sobering. It certainly gave us the evidence we needed to tell people this is no hoax. This is no joke. This is very serious. Many lives are at risk right now. You could be putting your own parents or grandparents or other loved ones at risk, that there's still a large degree of non-compliance, and that's why many of us have taken those measures to closing the facilities in our parks and to increase our bylaw enforcement. Many of us, Mayor John Tory, myself, others across the GTA, are going on an enforcement blitz this weekend on our parks and on our paths, and to ensure that people are complying with physical distancing and not gathering in numbers of greater than 5. And we will be ticketing people starting at $750 and up if they're non-compliant.
Mayor Dilkins, your takeaway as we listen to those very sobering projections?
Yeah, Vashi, I think, the last few weeks, certainly everyone's had their mayor's hat on and they're trying to work through the issues that confront the municipality. But when you hear a sobering figure like 15,000, it really makes you, for a moment, take that hat off and reflect as a husband, as a brother, as a son, as a father, that this is real. And people need to take this situation very, very seriously. And those numbers, if you need no other evidence, look at those numbers as the reason why you need to take this seriously. And I think of my own parents who were in their 70s and what the impact could be on them if they were to contract COVID-19. So please, everyone, keep the social distance. Take these numbers very seriously. This is not a joke, and death here is real.
Mayor Watson, when it comes to the measures that each municipality is taking, Mayor Crombie talked about a blitz, for example, of enforcement this weekend. We heard Mayor Tory talk a few days ago about canceling all events until the end of June. Where do you sit in those issues?
Well, in terms of enforcement, we certainly gave direction to our bylaw officers that starting today, no more warnings. They're going to start ticketing. And as Bonnie said, it's a $750 fine. And our bylaw officers now have new powers given to them by the province. And we're going out and, we've had people offering horseback riding lessons. Someone was running a garage sale the other day. People were playing beach volleyball on one of our beaches. Someone else was opening a hair salon. Just complete irresponsibility. Unless you've been living in a cave, why would people continue to flaunt the law and put themselves at risk and then come home and put their family at risk? It's completely idiotic, irresponsible, and now illegal. So we're it's enough of being the nice person. It's time to start ticketing these people. And as I said today in a press conference, we're going to kick them in the pants and then kick them in the pocketbook, because $750 is going to sting for someone who's being not very thoughtful of others by hanging around playing basketball or holding a garage sale in the middle of a pandemic. It's ridiculous.
Any thought, just a quick follow-up, to canceling city event permits for until June 30th, for example?
Yeah, we've been reaching out to our various festivals and groups of arts groups and so on, and we'll be making an announcement on Monday. But it's pretty clear that a number of events are going to have to be canceled. We don't know, for instance, what's going to happen on July 1st, because we know June 30th is one date. July 1st, as you know, is a big deal across Canada, especially in Ottawa. But looking bleaker and bleaker that these events are going to take place, which is a huge hit to the local economy. But it's the right thing to do. We can't possibly risk having big events, gatherings like Canada Day or Jazz Festival and Tulip Festival without putting other people at risk until this pandemic is over for good.
Mayor Crombie, you heard the frustration that Mayor Watson expressed. We've had a lot of politicians on this week who are equally frustrated. Is it a feeling that you share as you see people continue, and not the majority, but still some people continue to defy the orders put in place?
Certainly I'll address that, but also let me say that we will likely close down all of our festivals and events, not only till the end of June, but I can't imagine a welcoming 20,000 people into my Square for Canada Day after the day before everything was shut down. This looks like it's going to go out a few more months, so probably things will be shut down for much longer than we anticipate. I myself had a walk along our waterfront and witnessed a family, a large group in fact, playing on the swings, even though we had yellow taped off the playground. Can you imagine? So we've also seen evidence of people breaking locks, tearing down caution tape, knocking over barriers, because we've now gated all the entrances to our parking lots in our parks. So we see evidence of vandalism. We see the mesh and the fences cut, people attempting to use our soccer courts, our soccer fields rather, and our basketball courts. There's a lot of non-compliance. So I'm very hopeful this weekend that people get the message. It's okay to go for a walk, but you need to keep that physical distance away from other people, and you can't gather in groups of more than 5, particularly unrelated individuals. So I think Drew said it very well. I mean, I'm worried about my 84-year-old mother. She's in self-isolation in lockdown in her condominium, and she has myself and a PSW drop off her groceries and won't dare open the door. And I'll tell you, I've had a few conversations with Hazel McCallion. Her spirits are good. She's keeping very well, and she too is not allowing anyone to come in the home. They drop off any prepared food or groceries or medicines she needs outside the door, and then she wipes them all down with sanitary wipes and then washes her hands when she's finished. So you can imagine somebody who's lived to the age of 99 has pretty good advice to give everyone else. So please,
sure does.
If you're not worried about yourself, let's worry about other people. Let's not take selfish, irresponsible, unsafe behavior that could threaten the lives of people who are very important to ourselves and to our communities.
Quick follow-up for you, Mayor Crombie. The Premier today talked about the possibility of good weather this weekend, and I've heard anecdotally from a lot of people in this province, as soon as the weather's a lot nicer, they're seeing things that shouldn't happen. Are you worried about that this weekend?
Well, of course I am, and I have 23 kilometers of waterfront, so I can only imagine bright sunshine, warm weather, people wanting to go out and walk in our beautiful parks along the waterfront. And I'm telling you today, you will get ticketed if you're not $750, in fact, if you're not practicing safe social distancing or if you're gathering in groups. Try and go in off-peak hours or find a different route that's a lot less popular than some of our lovely parks.
Mayor Dilkens, I have to ask you about the big national story today because it so much affects people in your community, or at least they were invoked by the Prime Minister and the Deputy Prime Minister, and that is the 3M situation with masks. Your take on, the Prime Minister really emphasized the number of healthcare workers who reside in Windsor but work in Detroit. If we're not getting those masks, how does that make you feel?
Vashi, I love the United States, but sometimes their president needs to think before he opens his mouth, whether he's talking about putting soldiers on the northern border, or whether he's talking about opening the border fully by Easter, or when he's talking about reducing trade on essential supplies that both of our countries need. I think, the president needs to consider what a hard stop at the border would mean for him. And I think the Prime Minister is bang on, because in my community, if there was a hard stop at the border, that means there will be hospitals that close in the city of Detroit. Not that have to find other workers. They will absolutely close in the city of Detroit, in a place that is a known hotspot and in a state that this president needs to win if he hopes to win the next election.
Have there been any conversations, Mayor Dilkens? Oh, sorry, Mayor Watson, you want to jump in?
I was just going to say, I think maybe we need to get the mayor of Gander to go and call the president of the United States and remind him what the good people of Gander did and that wonderful play Come From Away during 9/11. We've always been their best neighbors, and this kind of behavior by the president is completely irresponsible and will cost lives.
Yeah, I call it unconscionable and immoral. In fact, I'll tell you, this is a topic of conversation on our emergency management calls each and every day. And what is the status of the PPEs in all of our community hospitals? Trillium Health Partners, we have 3 hospitals in Mississauga, and we're in good shape until the shipment arrives. But of course, if the shipment is backlogged, then there's going to be a huge problem.
Bonnie is bang on. It is immoral and it's inhumane. And if it happens, it'll be a tragedy, not just for Canada, but for the United States as well.
Okay, I'm going to leave it there. I really appreciate all three of you making time for us in what I know are very busy times for you. Thanks very much to Mayor Drew Dilkens, Mayor Bonnie Crombie, and Mayor Jim Watson. Hi, I'm Vashi Capellos, host of Power in Politics. See more of our show by subscribing to the CBC News channel or click the link for another video.